Mr. Mix?
Yeah.
Hi, my name's Ashley. I'm the registered dietitian. Would that be a good time to visit?
Yeah, sure.
Okay. Grab a chair here. Right. So your doctor notified me of your recent weight loss. How would you say your appetite has been lately?
It's been pretty normal as far as I know.
Pretty normal. Okay. And how have you been eating recently? How many meals a day would you say?
Oh, I mean, honestly, probably 2, but sometimes 3. They're not like full 3-course meals.
Or smaller meals? And have you been having any nausea or vomiting or any other symptoms that would affect your eating?
No, not. Mm-mm.
No. Okay. And then how would you say you'd feel about your weight loss? Have you noticed any?
I mean, it feels like my jeans are fitting a little bit looser.
Okay, so you noticed some. Okay. So what I'm here to do today is perform a nutrition-focused physical exam. And what that'll entail is starting from head to toe and looking at different areas of your body for fat and muscle loss, as well as micronutrient deficiencies. Would that be okay for me to do today?
Yeah, sure.
Okay, perfect. So I'm just going to wash my hands real quick. Okay, so I'm going to start with your hair here. Have you noticed any thinning or falling out?
No.
No, nothing. Okay, good. I'm going to work down to your temples here. This is an area where we can have fat loss. I'm noticing a little bit of caving in. Have you noticed anything?
I don't think so.
No, okay. It's subtle, so it's possible you didn't notice. Okay, so now I want to work on your to your fat pads. And those look good, but that can be an area where we lose fat if you're not eating well. Okay, and on your lips, I'm noticing some cracking. Is that recent?
Yeah, it's probably the past week.
Past week or so.
Kind of a little bit of dryness.
Dryness too. Okay. All right, can you go ahead and open your mouth and show me your tongue? Okay, good. And your teeth? Good, okay. Have you had any issues with chewing or anything lately?
No.
No. Okay. I'm going to work down now to your collarbone. So pull your shirt there. Okay, so I am noticing it's protruding a little bit. Is that normal for you, or have you noticed this recently, sticking out more?
I think I felt it like against the seatbelt more, so I think it's more there.
Okay. All right, I'll make note of that. Okay, so now I'm going to look at your shoulders. I see if they're nice and round. They do seem good and round, so that's good. All right, so I'm going to grab your arm here. I'm going to check for any fat loss in your tricep area. I have a good amount to grab, so there's no worry there. That is good. Okay. Now look at your skin. I'm noticing a little bit of dryness. Have you had any more dryness recently?
I mean, no more than just like what I said, with my lips.
The lips. Okay. All right. I'll look at your hands here, the muscles in between your fingers, and I'll look at your nails. Another common spot we can notice micronutrient deficiencies, but I'm not seeing anything. Okay. And are you right or left-handed?
Right. Dominant.
Right, dominant. Okay. So with your left hand, can you go ahead and make the okay sign for me? Okay. So this muscle I'm checking here is called the interosseous muscle, and that can be an area where we lose muscle, but I'm not noticing any. So that's good. All right, and then I'll take this hand again, and I'm going to check your what's called the skin turgor, and that's a good way to check hydration status. So did you see how it went down quickly?
Mm-hmm.
That means you're well hydrated, but if it were to stay up, that would mean that you didn't have enough fluids in your body. Yeah. All right, so are you able to lean forward for me a little bit? Good. Okay, so I'm going to check your scapula here to see if they're protruding at all. Okay. And then the right arm, can you go ahead and press against my arm? The straight arm? Okay. Just like to check the muscle there too, your scapula. Okay. You can go ahead and put that down. Now I'm going to check the fat around your spine to see if there's a good amount covering, and I am noticing that there is a good amount, so that's good. Okay, and I'll work my way down. It's called the mid-axillary region. Check for fat loss there. I'm not noticing a lot of fat. Have you noticed that recently?
Well, probably the makes sense with jeans
With the
fitting.
jeans. Yeah. Okay. All right. So make sure, see if you're noticing that too. Okay. So now I'm going to work my way down to your legs. Can you go ahead and bend both legs up for me? Good. Okay. I'm going to roll both these up. Okay. So now I'm going to check your quadricep muscle. Both legs. And what we like to see here is that the knee isn't wider than the quadricep. That would indicate pretty severe muscle loss, but it doesn't look that way, so that's good. Okay, now I'm going to work on your calf. Also a good amount of muscle there in both calves. That is good. But we always want to make sure we check all the areas, you know. Okay, so you can put down your legs. Good. Okay, and now I'm going to check for some swelling in the ankles. All right. So if there were some swelling, that would mean some micronutrient deficiencies, but there doesn't seem to be. My finger, it's not leaving an imprint, so that's how we know.
Right.
Okay. All right, so that is all I have for the exam. Do you have any questions for me at all?
I don't think so at this time.
Okay, just gonna wash my hands real quick. All right, so I did notice a few areas of to be concerned with: your cracking lips and the collarbone, some muscle loss there, and a little bit of the fat loss on your side. But what I'm going to do is report my findings to the doctor, and then we'll go from there to get a plan for you in place to help you start eating better. Okay?
All right, sounds good.
All right, thank you for your
Appreciate it.
time. Yeah.
Thank you.
Yep.